Welcome to Psych Talk for primary care providers, where our esteemed faculty members will provide you with invaluable insights to seamlessly integrate into your daily practice. Dr. Melissa Wagner talks about how to interview children and adolescents, what to ask, and how you ask your questions matter.
Hi, I am Dr. Melissa Wagner. I am one of the co-directors of the Child and Adolescent Psychiatry TNT PCP training program for primary care physicians. We focus on training our primary care providers on both adequately diagnosing and interviewing children and their families, which can actually be really challenging given the different ages of development of the children that you see. You see kids from all the way from 0 up to 18 to 21 years old. And there's really unique differences when you're assessing children throughout those age groups. So what I like to focus on is both educating our primary care providers about the most likely diagnoses that are going to present at different age groups based on brain development. So if we're thinking of our really young kids from 0 to 3, 0 to 5, what normally presents are things like autism spectrum disorders, learning disabilities, ADHD. And as kids age, as they get into early grade school, you're much more likely to start to see things like separation anxiety, generalized anxiety disorder, school anxiety, and school avoidance behaviors. As kids move on to later grade school and middle school is when you start to see different things like mood disorders present, such as major depressive disorder. And as adolescence goes on into early adulthood, that's when you would first likely see things like bipolar disorder and other more serious mental illness, such as schizophrenia and other psychotic-based illnesses. It's in these adolescents that we also start to see issues with substance use disorders. But when we're assessing these families, it's really important for the pediatrician or the primary care provider to feel comfortable setting the stage for the child and adolescent interview and being really forthcoming with the family and the child that you're going to interview them both together and separately. And this goes all the way down to your young 2 to 3 year olds, is to really try to separate them, at least for part of the interview, from their parent so you can get their perspective. And as you separate the kids, it's really important that you use appropriate language. So if you're thinking about your 2 to 3 year olds, your 4 to 6 year olds, you're going to use simple language. You're going to try to avoid repeating questions. Kids at this age often really want to please the adult. And if you repeat a question, they may give you a different answer because they believe that you want to hear something different. As you move on to later grade school ages and adolescence is when you can start to use a more open-ended and reflective questioning. It is at around age 11 or 12 that kids develop the ability to move from concrete thought process to being able to think about their feelings and emotions in an abstract fashion. But really before age 11, they cannot do that. And so if you ask them to think about a complicated situation and reflect, they won't be able to give you an answer that represents their true feeling. They're likely just going to be trying to impress you. When we think about that, then we also think if you're treating kids in these different ages, your behavioral therapeutic techniques need to be modified for the development of the kid. So if we think about both motivational interviewing and cognitive behavioral therapy techniques that you can use in the office, you have to change them relative to the age of the kid. So for really young kids, I would say from ages 3 to 10, I like if someone comes with a problem regarding some type of fear, some kind of anxiety disorder, I really focus on using simple cognitive behavioral therapeutic techniques, such as having the kids list the evidence against why that negative thing will not happen to them. Their anxiety is already focused on all of the evidence for why their worries are taking over their whole thought process. So really encourage them to tell you why those things are not going to happen. And as far as thinking of like mindfulness techniques at that age, using really simple breathing techniques. So sometimes the more complicated breathing exercises that we talk about with our older children, our adolescents, and that we often talk about a lot with adults, which is different patterns of breathing, different counting techniques, using the concept of square breathing techniques to decrease anxiety. Those can be too complicated for our younger children. So what I really encourage families to do is to make a glitter jar, which is really simple. You take a mason jar, you put water, clear glue, and glitter, and you have the kids practice. You shake the glitter jar up, and you have them take deep breaths until the glitter has gone from the top of the jar to the bottom of the jar. And you're still it is very similar to the technique of box breathing or different counting breathings, but the young kid doesn't have to focus on some of those more complex operational skills. And with that, I just overarching what I think is really important for us to impart on our primary care providers is to be really thoughtful about taking these developmental approaches when they're both interviewing and then prescribing treatment to these families and children.